David McAtee is with us, Community Relations Specialist for Yavapai County Health Services. Dave, we're just talking at the break, you know, it's so hard these days with regular physicians to even get in and get an appointment, but you will take anyone. You will take the children, the adults, but they do still need to make an appointment, or it's preferred.
Yes, we prefer you make an appointment. We can on occasion take a walk-in. We're not an emergency room, so if you're bleeding, you know, go to the emergency room.
Or urgent care.
Urgent care, absolutely. But yeah, we take absolutely anybody and everybody, and we do have quite a wide variety of people that come.
Now, if they don't have insurance, you'll still take them?
Yes, if you don't have insurance, if you apply or you're eligible for access, or if you have insurance, we'll take you. And if you don't have insurance and you're below the national federal poverty level, your payments or your charges are on a sliding fee scale.
Okay.
Tobacco companies want a judge to put a stop to the new graphic cigarette labels that include the sewn-up corpse. We all know what this includes. We've all seen this campaign, and we know what's going on with smoking. A recent survey was, yes, smoking kills. No, Washington should not babysit us, and not sure. When I read that survey, I was interested. It was very interesting to me that it's yes, smoking kills, and then the other one you could check was no, Washington should not babysit us. Well, I think that sends the wrong message. We know smoking kills. I mean, yes, it kills, but should Washington be the big brother on smoking?
You know, that's a tough one. There's the George Burns effect, you know, the guy that smoked to 100 years old, and so that's a difficult argument.
It's Russian roulette. It's a crapshoot, obviously. We know that.
It absolutely is. Should it be a federal issue? I personally think it should be dealt with on a state level. And really, we do a pretty good job. In Arizona, we do Smoke-Free Arizona, where you aren't allowed to smoke in many of the bars and restaurants and everything. And that's one of the other things that we do as the county is sort of help people, educate them to the laws and what is allowed and what's not allowed, and where you can have people smoke and where you can't.
It's funny, you can't legislate people to stop smoking, and you can't legislate them to lose weight. This has to be an individual decision.
It does.
A person wants to do this.
It does, but when it comes to businesses, then I think at that point you can say the government can have some control as to what is being affected, what the public is being exposed to, and that's what we're trying to do.
But that's a fine line, David.
It really
I think
is.
Tonya makes a very good point. It's got to be personal responsibility. And if we don't get back to that, the more the government regulates, the less freedom we have.
Sure, you're absolutely right. And I think one of the things that we do is work with the restaurant owners to educate them as to why this is important, why smoking is dangerous, and how the rest of many of the public, we have about 25% of this state that smokes. That means 75% of the public isn't, and they don't want to go into restaurants that are full of smoke. And so we're helping them develop areas outside where they still can smoke. They're just not going to be forcing those that don't smoke to be exposed to that.
In dealing with people, in servicing the people who come to the Yavapai County Health Department, common across the board threads of concern?
We have a program called WIC, which is Women, Infant, Children.
Oh, I've heard about that one.
And unfortunately, it's one of the sort of groups that's being cut because of financial issues, but it's incredibly important. We do nutrition education for young mothers. So you've got a brand new baby, help with breastfeeding instruction and direction. But more than that, we provide checks that you can actually go to the grocery stores and buy that healthy food, the vegetables and the beans and the rice and the cereal and the milk and that kind of thing.
How do we stop, and you probably don't have the answer to this, David, but there's so many abuses in the entitlement program, so much abuse. How do you keep a lid on that, at least from where you're sitting?
You know, that's a really good question, because most of the money that we get does come from grants. The county actually pays for very, very little of our services. So we're going out and we're actively seeking grants from organizations, private organizations. Some of them come from the federal, state government. Yeah, a very small percentage of our budget actually comes from the county. On the health side, the clinic side, most of that budget comes from billing insurances like Access and private insurance. So we're really a very small percentage, I mean, very, very small percentage of the county budget, and we like it that way. We want to know that the public is supporting that in their insurance and in their grants. So,
speaking of a very small portion of the budget, has that very small portion even been cut further?
It has. Unfortunately, like I said, our WIC program is being cut a little bit, so we have staff cuts. Some of our in-home care, we do a lot of support for the elderly that want to stay home. They don't want to live in a home or a supported home, hospital situation, because it costs less. we send people out to visit them, check on them, help bathe them in certain situations. And so we do a lot to help the public in that sense.
You were mentioning too that all the services, can you just give us a few of the services? Obviously we're talking about the healthcare, but you have so many other services at the county.
We do, and one of the things that we haven't talked about is immunizations. Everybody knows about child immunizations, especially with school coming back, and we held several free clinics for those that couldn't afford immunizations because it's very important. But we also do adult immunizations. Most people don't know that at certain ages of adulthood you need to get boosters, which is not fun. You know, it's easy to take your kid to the doctor and get him shots.
What type of boosters are you talking about?
Tetanus.
Tetanus is one.
Pertussis, which is whooping cough, which is a big one.
Ooh.
We have a thing called...
That's pretty much eradicated. Oh,
It's
do I
coming
sound
back.
typical? Here? I better not say that.
It's amazing the number of cases of measles that are coming back.
Really?
Yeah, because people don't immunize their kids and they don't immunize themselves, and we're seeing.
Well, now, what should an adult do?
Yeah.
What
do we
should an
do?
adult do? Should you walk into the county health department? I
say,
know we
immunize-
need to get a shot, Forrest. That's why I'm hoping he says something else, but I think it's going to be a shot.
Yeah, actually, it's true. We have an immunization department that not only does a child and adult, but also travel immunizations if you're going to leave the country. So there's all kinds of stuff that you can do. Pertussis is one, tetanus, diphtheria. These are the big ones.
Do you know if the schools still do that? I know when we were going to school, Tonya, it was required.
Oh
We
yeah,
had
you
to
did
have-
in school. You lined
Is
up
that-
in the class.
Yes.
Well,
and here they
most of
came.
the schools are required to show proof that the kids have been either immunized or they've written consent that says because of religious reasons we're not going to.
elect to.
And unfortunately, that's becoming more and more prominent. It's just something that needs to be done. And
That could be dangerous. I know there's many pros and cons to that, the effects of immunizations, but that's a whole nother show.
We'll talk about that
David,
later.
very interesting. Thank you for being with us this morning. Appreciate it. Great information.
When we come back, Warren Eckstein, he is your favorite neighborhood pet psychologist, pet trainer. He's going to talk cats and dogs.
But first, there's a wonderful building going up just around the corner from our studios, and it houses Prescott Honda.
They're about to move. I don't know how soon they will be moving. They're still in their old location. But as Lou said, the new one is coming right along. Prescott Honda is the place to buy your automobile. Now listen, they're going to have an open house, and they're going to get so many of you out there who have never even gone to Prescott Honda, and about half of you will buy automobiles. I can guarantee that. Prescott Honda is the place to buy your car. If you don't want a Honda, previously owned automobiles will be there also. Prescott Honda treats you well before, during, and after the sale.
Clear.